Okay, so what we're going to go over today is an oral mechanism exam for those with cleft lip and palate and what to assess with that. So the first thing you want to assess is the palate. You want to see if it's intact or abnormal. So to do this, you'll use a light and a tongue depressor to inspect the hard and the soft palate. You want to look for any clefts, submucous clefts, or surgical repairs or scarring. And you can also ask the child to say ah to see how the palate moves. Then you want to assess velar elevation, see if that is inactive or active. So again, you can ask them to say ah or e and observe whether the soft palate lifts towards the posterior pharyngeal wall symmetrically. And you also want to note whether the movement is reduced, asymmetrical, or absent. Then you want to look at dentition. So you want to look at the occlusion between the upper and lower jaws. You want to see, is that a class 1, which is normal, a class 2, which is an overbite, or a class 3, which is an underbite. So you want to have the client bite in their natural resting bite, so have their teeth together, and you want to compare the relationship between the upper and lower molars. While you're doing that, you also want to observe whether the front teeth touch when the mouth is closed. You want to see, is there a visible gap between the upper and lower teeth? If so, that would be an open bite, and that can affect some different sounds. You want to see, is there a fistula present or absent? So you want to inspect the palate closely for any small openings between oral and nasal cavities, especially in repaired clefts. You may see a small hole or feel airflow through the fistula during nasal emission testing, which is something we did in the prior section where we went through the testing materials. Then you just want to look for symmetry for all the structures like the uvula, the soft palate, and the facial muscles. You just want to see, are they symmetrical or asymmetrical during rest and movement. And you also want to note if one side elevates higher than the other. And then back to dentition, you just want to see if there's a crossbite. So you want to observe whether or not upper teeth fit outside or inside the lower teeth laterally when biting down. And there are other things you can look at. Definitely if you see any red flags during your assessment, you can go dive deeper into those areas, but these just cover the basics that are specific for cleft lip and palate.